Oh my God, we're live.
Hello, we're live. Good morning, everyone.
Good
So,
morning. Good
just waiting
morning.
for people to join us. Just waiting for people to join us now. So, just to introduce ourselves. So, my name is Lisa. I'm one of the teachers here at MyES Milano Miravilli. And Cathal, would you like to introduce yourself?
Yeah, my name is Cathal. I'm also a teacher here in Meravili, and I'm also from Ireland.
Yes. Okay. Yeah. So we're both Irish teachers here. And I've been living in Italy for 2.5 years. Cathal, how long have you been living in Italy?
I've been living in Italy for just over 1 year.
Fabulous. Okay. Amazing. Is it just ourselves?
Might be. I didn't know that we've one person watching us.
Okay. So we have one person out here. Can you tell us your name, where you're from? If you're
Let me wait for
downstairs in the school?
that.
Potentially.
Potentially.
Okay.
That might be something.
Well, anyway, if you're listening, so obviously these webinars we're having at the moment to help you to practice your English. And it is 9 o'clock on a Monday morning, so you can imagine everyone is a little bit sleepy. Okay, so will we continue, Cathal? I'm confused now.
I mean, sure. Yeah, it's gonna be. We're gonna be publishing this anyway, so good to have the content
Okay,
going.
perfect. Okay, amazing. Well, anyway, if we have the content, then today we're going to talk about pharmacy. Okay, quite topical right now with everything that's going on. And also practicing some vocabulary about when you're sick, when you maybe have an accident, have a problem. So to practice some different vocabulary to do with that. Okay, so that's what we're going to take a look at today. Here we go. So in this focus activity, so what we're going to practice is describing some problems. Okay, so describing if you have a health problem or if you've had an accident, how we can describe those in English. Also talking about pharmacist. So the pharmacist is the person who gives you the medicine in the pharmacy. So the directions they give, okay, the directions they give. And also just some common phrases that we use in a pharmacy or in a medical situation as well, in a medical situation. And then, as I said, vocabulary. So a lot of vocabulary, especially if maybe at a different time, not right now, if you are in another country and you need to explain a problem or to tell someone what is wrong with you if you have an issue. Personally, I have had this situation many times in other countries. I don't know about you, Cathal. Have you had this situation?
I mean, in other countries, maybe not, but for sure, I've had this problem in Ireland anyway.
Yeah. Well, unfortunately, every time I not every time, but a lot of times that I travel, I get sick. So it's happened to me in when I was in Italy on holidays, in New York on holidays, in Spain on holidays. So it's a common thing. You need to go to a pharmacy when you're in another country. Okay. So just to start, we have a little thing to read here. So what it says, a pharmacist is telling a patient how to take his medicine. Do not take this more often than every 4 hours, he says. Don't worry, replies the patient. It takes me 4 hours to open the bottle. Okay, so a bit of a joke to start. So obviously, just to mention, in this case, they're talking about the types of bottles for the medicine that are very difficult to open. because they're childproof. So that's what we call it when it's childproof. So it's difficult to open the bottle. I think this is an exaggeration. I don't think it takes 4 hours, but anyway, get the joke.
I can't see it taking 4 hours.
Unless you really, really don't know what you're doing. Usually it's push and twist. Okay, and just to mention, so the patient is obviously, in this scenario, the patient is the person who is sick or who has a problem, the patient. And the pharmacist is obviously the person working in the pharmacy, like this lovely lady here. Guys, if anyone has joined, just feel free to send us a message. Tell us where you are, your name. Perfect, fabulous. Thank you, Cathal. That's great. If you're watching, just send us a message. Tell us where you are and your name as well. So you can type to us in the chat, and Cathal is going to answer any questions or anything that you have. Okay, so here we have some British and American English. Okay. So we're going to match them with the equivalent. Okay, so if I say I'm ill, okay, I'm feeling ill, I can say sometimes I'm feeling ill. This is kind of a British English expression. So to be ill, but it's similar in American English, we would say to be sick. Okay, to be sick. So if I say I am sick, I am ill is the same thing. Okay. That should be straightforward. And then a scrape. Okay, so a scrape is another word for a scratch. So just to explain what this is. So if I have, you can see my arm here. If I have a cat and the cat goes on my arm, that's when they scratch you. Okay, when the cat scratches you. So with their nails. Okay, so this can be, so to scrape or to scratch, it can be a verb and a noun. Okay, because I can have a scratch. Okay, a scratch is the mark on my arm, and to scratch is the verb. Okay, the cat scratched me. Okay, we can use it like this. Okay. And yeah, whereas a scrape is just another word. I would say, would you agree, Cathal? I would say scratch is more common.
Yeah, I think so. Scratch, I would say, is more common as the verb, and scrape, I think maybe I would use more as the noun.
True, actually, true. Yeah, because sometimes a scrape, I find... you would say, I scraped my knee if you fell over and then you had a scratch on it. You would say it that way, like when it's self-inflicted.
Yeah, exactly.
Yeah, I don't know why we use it that way. Okay, and then this one, very important because it's something very commonly that we all use. Okay, so in the UK, we say plasters. Okay, plasters. And the equivalent in America are okay, band-aids. Basically what that is if you do scratch, another way, so to say here, a cut. Okay, a cut. So that'll be, I don't know, you cut your by accident, so you're bleeding, so there's blood. In that case, you put on a bandage, which is called a little bandage. It's called a plaster. Okay, a plaster or a band-aid. But America, band-aid is actually a brand. Okay, so you might still have it here in some shops or in some pharmacies. Band-aid is a brand, and it's just so common that they're called band-aids in America. But yeah, so it's very common. It's the thing you put on, and also if you're a woman, you use plasters and band-aids on your feet for if you're wearing shoes, like high shoes, if you have problems with that. Okay, so I see we have a couple more people joining us. So feel free, as I said earlier, to type to us if you have any questions or if you just want to introduce yourself and tell us your name and where you are, that would be brilliant. Okay. Okay. So then, also just to mention, in English, a pharmacy is often called a chemist. Okay, a chemist. We're talking about the place that you go for medicine. It can be called a pharmacy or a chemist. So in the UK, it's more common to have chemist, but they both have the same meaning. So then the person is also called a chemist. So like this lady here in the picture, a chemist or a pharmacist. Okay, chemist or a pharmacist. It's just another name. Obviously, chemist is more old when we talk about it's an older word for the person who gives medicine. And it's more scientific, I would say. Do you agree, Carl? I think it's more scientific.
So, yeah. Well, chemist coming from chemistry, of course.
Yeah, exactly. So it's almost like, sounds like the person who makes the medicine. So I always associate it with it being older.
Yeah, for sure.
Okay. Yeah, exactly. So those are just some concepts to go through for anyone who maybe joined a little bit late. So ill, so to be ill is another way to say I am sick. You can say I am ill, it's just more British English, or I am sick is more common. A scrape is the equivalent to a scratch. So when the cat scratches you, you have a mark on your arm or your leg, whatever. And plasters are what you put on your finger if you have a cut or a bad scrape. And then, yeah, chemist is another name for a pharmacist. So the person in the pharmacy. Okay. So then, help me. So these are some common problems, or as we could say, maybe maladies. Just heard another bit of vocab there, malady. So what is the best way to describe these? So we're going to match the vocabulary with the picture. And also, some of these, the pronunciation is a little bit difficult. So I'll just repeat the pronunciation of some of them because they're very common. So so as I said, true of a scrape. Okay, scrape. So we could say that's a scraped knee. Sorry, it's not very pretty for a Monday morning. Okay. And then picture B. Okay, so picture B, a really severe example of someone who has been in the sun for too long and they have not put on cream. Yes, every Irish person ever. This is very typical in Ireland because we don't get the sun very often. So when we do get the sun, we are not prepared and we're too white. So this is how we call this sunburn. Okay, sunburn. So it's a really severe sunburn as well, I would say. Okay. Whereas this cute little baby here, so this isn't really a problem unless you're not prepared. It's just being in the sun, okay? The act of being in the sun. Whereas then, okay, D. So this is very important, especially now. Okay, so when I do this, this is a cough, okay? A cough. Okay, so a pronunciation, that O-U-G-H, it makes a F sound, okay? So cough, cough. What I always say is the pronunciation is just like the start of coffee. So it's like coffee, you take away the E, cough. Okay, cough. This is cough. Then, very common, okay, a headache. So when you have a pain in your head, okay, a pain in your head, we say, I have a headache. Okay. If you want to add emphasis, I have a bad headache. So you can say, I have a bad headache in this case. So just remember, so it's a and ache. It almost makes an AKE sound, ache. Okay, ache. So an ache term for a pain, okay, an ache. So if you have, for example, you can have an earache. It's a pain in your ear, okay, an earache. Or very commonly, a toothache, toothache. Okay, so a toothache. So it means a pain in your tooth. So we use ache quite commonly to describe a pain in something. Okay, so that's a headache. If we want to explain, so sometimes a very, very severe headache, so if it affects your vision, or also it affects, maybe it makes you feel a bit sick, that's called a migraine. Migraine. Okay, so it's very similar in Italian, a migraine. Okay. Simply, this poor child over here, bless her. As we can see, here we can just say she is sick. Okay, she is sick. She is sick. So we can see here she has something in her mouth. So something in her mouth. So this is called a thermometer. Okay, a thermometer. Okay, a thermometer. So with the thermometer, you take your temperature. Okay, so I know sometimes now people use ones that you just put them across your head. You hold them there, but this is the old-fashioned thermometer. So we say to take my temperature, or to take a temperature. Something that's important at the moment, obviously, if people are not feeling well, they have to check their temperature. Okay, check their temperature. Okay, and then just to mention in terms of vocabulary, one that's not here, another one that's very common. When you're sick, you go ha-choo, choo. Okay. So this, don't worry, that's fake. I'm not sick. That is called a sneeze. A sneeze. Okay. Okay. So we can say it's a noun, a sneeze, or the verb to sneeze. Okay, to sneeze. So I can say I sneezed. Okay, I sneezed, or he sneezed. Whatever. We can say it this way as an action. But usually, just to mention, I sneeze, we say, oh, excuse me. Okay, excuse me. And then the other person, so if I sneeze and I go, achoo, Cathal, what do you say?
Say, bless you.
Bless you. Exactly. Bless you. In the name of the Father, Son, Holy Spirit. No, joke. So bless you is what we say after someone sneezes. Okay, and then any other sickness vocabulary you think we should add there, Cathal?
For sickness, I think you've covered a lot. Very good. I mean, in terms of ache, because headache, backache, stomach ache, another way we can say ache is to say I have a pain in my arm or my leg. Instead of saying I have an arm ache, we just say I have a pain. So to have a pain in whatever part of your body, your jaw, your tooth, your shoulder, whatever the case may be.
Exactly. Yeah. So yeah, there are two ways to say it. Really good. So 2 ways to say it. Okay, brilliant. So then we want to talk about remedies. Okay, remedies. So remedies are, for example, the cure or something to help. Okay, to help when you have a problem. Okay, so in this case, we say I need. Okay, I need something. Okay, so obviously looking at that. So the remedy for a scrape, or as I said, a cut, if it's more severe, if it's open, it's called a cut. So in this case, the remedy are plasters. Okay, plasters. Okay, so you put on a plaster. Obviously, if it's really bad, if you've had a bad accident, if you have a bad cut, you might need to get a big bandage, which is more the one that gets wrapped around. Okay, but plasters are very common because they're for small accidents like this. Okay, and poor man with the sunburn. Okay, so something we can say he needs. Burn cream is, I would say, for more severe burns. Okay, so it's more medicinal after you've if in this case he has a severe burn, so maybe he needs a medical cream. The normal one that we use, that Irish people always use, is called After Sun. Okay, After Sun. So very important. If you get sunburn,
Lisa,
you take your After Sun with you.
Cream or After Sun lotion?
I actually just say After Sun. Do you say After Sun cream?
I mean, because usually it comes in the bottle and it's not a cream, it's more just a clear liquid. So I guess maybe lotion, I would say, as opposed to cream. That's why I was kind of thinking like that. So After Sun or After Sun lotion, maybe?
Yeah, exactly. I always just call it After Sun in general. So yeah, I wouldn't call it a cream. It's a bit different. But yeah, I think lotion, probably After Sun lotion, because it's more fluid. It's more fluid. Okay. Yeah, exactly. And then this is so after you get a burn, okay, or after you get a burn. But before, to avoid getting burned, you can put on, so this child in this case, what is called sunblock. Okay, sunblock. So just to mention, sunblock you put on your skin so you don't get too much sun or you don't get burned. But this is American English. Okay, American English. In the UK and Ireland, we would just say sun cream, to put on sun cream. Very good. Thanks, Cathal.
No problem.
Okay, to put on sun cream. Thank you. And then, very similar to Italian. Okay, so very nice. It's the first time I've seen it. So very similar to Italian. So when you have a cough, as I said, a cough, the medicine that we usually take for this is called cough syrup. Okay, cough syrup. So usually the one you have to take from a bottle to help your cough syrup. Okay, cough syrup. And then this lady who has the headache. So in this case, she needs painkillers. So just to mention, this is just the general, so overall, any type of medicine that helps you when you have a pain. Obviously, there are different levels, different types, like paracetamol, all different types of painkillers. But this is just a generic name for all of them. Okay, painkillers. Do we have another term for painkillers? Is my brain a bit slow?
No, I can't think of one at the moment. Maybe I can check if you want to, but
no,
I don't think so.
No, because I just think as well, we would often just call it by the type of painkiller that's in it, like paracetamol, ibuprofen. We would the same way in Italian. We would often just call the individual painkiller by the type of medicine that's in it. Okay. And just in general, so we would say, I need painkillers, so asking. And in this case as well, so when we take them, I took painkillers for my headache. Okay, I took painkillers for my headache, or a painkiller, obviously. And then just in general, obviously, it's very similar. When someone is sick, you take medicine. Okay, you take medicine. So again, that's very general. Medicine can be any type of medicine, any type of thing that you take, any type of remedy. Okay, so that's a lot of vocabulary, a lot of different vocabulary. But yeah, hopefully it's helpful if you describe a problem at a pharmacy, okay, at a pharmacy, or just in English if you're visiting another country. So guys, as I said, just if you're watching at home and if you have any questions, please feel free to type to us. Okay, so you can write in the chat window to ask us a question if anything is unclear. Okay. So in this case, so here we have to decide, what do you need to buy at what do you need to buy at the pharmacy? Okay, so I'm going to invite you guys, if you want to try and practice your vocabulary, to write to us with the answer for this, okay? So in this case, what do you need to buy at the pharmacy if you are going to the beach this weekend? Obviously, nobody is doing that. Imagine. So if you're going to the beach this weekend, what do you need to buy? Well, if you're Irish, I think there's a lot of very obvious things we need to buy. I'm just going to give a minute to see if anyone can answer, what do we need to buy? Just going to try. Anybody?
There's usually a bit of a delay on the chat anyway.
Yeah, I'm just trying to give a chance in case, but I'll obviously continue in a second if nobody responds.
Of course.
Okay. Cathal, when at the pharmacy? Hey, amazing. Lorena, thank you. Exactly. If you're going to the beach, you need to buy sunblock.
Fantastic.
Excellent.
Nice job, Lorena.
Very good. Very good. Okay, yeah. So in this case, I need to buy sunblock, or the other name, I need to buy sun cream. Okay, sun cream. Excellent. Okay. And then, like the poor man with the sunburn, in number 2, you stayed in the sun too long. Okay, too long. Usually in Italy, people don't have this problem because because we have very different skin. So like I would say, I'm very pale. Okay, so when my skin is very white, I say it's pale. Okay, pale. Whereas, very good, yeah. Whereas in Italy, usually people are very tanned. Okay, they're very tanned. So you don't usually have the problem of getting burned very easily. Okay, so tanned is when your skin goes brown from the sun, and pale is myself and Cathal.
Super white, as you can see on the screen.
Yes, so white, just like milk. So in the case of if you stayed in the sun too long, you would say, hello, I need, so you'd probably say, I need after sun, or I need after sun lotion. Okay, after sun lotion. Okay, and then what do you need to buy if your son coughs a lot? Okay, so remember that pronunciation. So this is third person. So he coughs a lot. So Cathal, what would you need to buy?
So if my son coughs a lot, I need to buy. I need to buy some cough syrup.
Exactly. Perfect. Some cough syrup. Okay, so some cough syrup. Perfect. So if someone has a cough, and then in this scenario, perfect. Oh, excellent. Bit of Italian thrown in there. Oh, fancy. So then your your dog. So hurt her knee. She hurt. So in this case, so hurt. So hurt is actually a word where it's like it's not very severe. Okay, because she injured her knee, but to injure is more severe. To hurt probably means just a little bit of pain. So it's less strong than injure. Okay, so she hurt her knee. Probably, in this case, she probably just fell down, I would imagine. Okay, so to fall down is when you just fall over. So usually children, this happens a lot. Okay, they fall down because they're running, they're not paying attention. Okay, so in this case, she probably fell down. So we could imagine if she fell down, she probably has a cut or a scrape on her knee. Do you think?
I think so.
A scrape on her knee? Okay, so remember, if you have a cut or a scrape, you need plasters. Okay, plasters. Or if you're in America, Band-Aids. Okay, Band-Aids. Okay, plasters or Band-Aids. So remember, plasters, UK English. Band-Aids, US English. Another word actually that wasn't on our list, so just to mention. So if I fall over, okay, so if I fall over or if I hit something, a part of my body, so maybe sometimes I walk into things. So when you hit a part of your body and it's not a cut or a scrape, but you have a blue or purple mark on your skin, okay, a blue or purple mark on your skin, called a bruise in English, a bruise, okay, a bruise. So it's a blue or purple mark when either you fall over or maybe you bump into something, so you get a bruise. So the skin is not broken, but the skin is injured and it's painful. Okay, it's painful. So that's called a bruise. So in this case, if the girl fell down, she might have a bruise either. She might have a bruise. So just to mention, so when I said I walk into things or I fall over a lot, how I would describe myself is I would say I'm clumsy. I'm clumsy. So yeah, clumsy. Clumsy is a person who falls over or hits things. I walk into like the door all the time.
Generally,
yeah, you're
not
clumsy if you don't
coordinated.
pay attention. Exactly, yeah, imbalanced, shall we say.
Very polite way of putting
it. Don't have great balance. So yeah, to be clumsy. Okay, so yeah, you would say either I'm clumsy or he's clumsy to describe a person who maybe has a lot of little accidents. Okay. And then the number 5 is just a generic problem. Okay, so you are ill. Okay, no specifics here. You are ill, or like we said, another way to say this, you are sick. So in general, if you're sick, maybe to get better, you need to take some medicine. Okay, some medicine. So yeah, in this case, to be sick, it could mean anything. It could mean you have a cold. It could mean you have a flu. It could mean that you have maybe a problem in your stomach, maybe a stomach ache. Stomach ache. Mm-hmm. Okay. Should I cover the difference between cold and flu? Probably it's a good idea.
Yeah, sure.
Yeah. Okay, sorry. I'm throwing loads of vocabulary at everyone. So just to mention, When we say in English, I have a cold, it's the most common type of illness, okay? Especially this time of year, to have a cold. So it's usually when you have a sore throat, okay? So a pain in your throat, and a cough, and maybe you're sneezing a lot, okay? Sneezing a lot. So with a cold, you sometimes have a temperature, okay? A high temperature, but you don't have a fever, okay? You don't have a fever. You just maybe have a little bit of a temperature. So it's not very severe. It's not very severe. Whereas when we say I have a flu, that is really, really bad, okay? It's a lot more severe when we say it in English. So usually we commonly say I have a cold if you're a little bit sick. But if you have a flu, probably that means that you can't leave your bed, you have a fever, a lot of pain in your body. So yeah, you can say I have a flu, or yeah, in general, to have the flu as well, to have the flu. Okay, so yeah, so we use cold a lot more commonly. Okay, thank you for that, Cathal.
No problem.
And guys, just as I said, if you have any questions, please write to us. And if you have anything at all you want to clarify, because we have a lot of vocabulary and a lot of phrases in this case. Okay, and then the last one. You have back pain. Perfect. Okay, Francesca, no problem. Okay, just saw your message there. No problem, don't worry. We actually, so there are continual lessons throughout the day. So don't worry if you're arriving late to this one. There will be another one as well, won't there? At 10 o'clock? I imagine.
6 to 7,
exactly.
6 to 7, the next one will be at 12 o'clock.
Okay, 12 o'clock. But maybe there's a webinar by someone else, not in our school?
Yeah.
Potentially?
Maybe, I think so.
Yeah, but anyway, if you want to see Cahill's lovely face again, we will have another webinar at 12 o'clock. But thank you, Francesca, for writing. You're very welcome to the lesson. And if you want to just look through, Francesca, you can look through the comments to see any of the vocabulary that we've talked about already. Okay. So you have back pain and a headache. Okay, so like we said, when you have back pain, okay, so you have a problem. So it's some sort of ache. So you can, another way to say this is I have a pain in my back, or I have a backache, okay, and a headache. So in this case, there's a pain, some form of pain. And in this case, we would take painkillers. Okay, so you would need to buy some painkillers. Okay, so there, Francesco, thank you for back sore. So we wouldn't say it like this. We would more likely say my back is sore. Okay, to describe it. My back is sore. Because sore, in this case, we're describing it. So usually when we say my back is sore, perfect. Okay, my back is sore, or like in the example, I have a backache. I have a backache. Or again, I have a pain in my back. We have, unfortunately, many different ways to say the same thing. Perfect. That's great, Francesco. Excellent. So we have many different ways to say the same thing. But as I always say to the students, you choose the way that is more comfortable for you. Okay, the most comfortable for you to say, or the easiest. Perfect, exactly. So yeah, I have a backache as well. Okay, so in this case, the person would take some painkillers. So then, as I said again, let us know if you have any questions. But we're just describing some remedies and what you would need in a pharmacy. Okay, so now we want some important and common questions. Okay, so common questions that are asked in the pharmacy. So the first one, how many times per day do I need to take this medicine? Okay, so how many times per day? So usually if you're sick and the doctor has prescribed the medicine, okay, they give you a prescription, okay, a prescription. When the doctor, they give you a prescription. So it's a little piece of paper, So when you're given the prescription to the pharmacist, okay, you give the prescription to the pharmacist, you need to ask, how many times per day do I take this? Okay, so do I 2 times a day, 3 times a day? Okay, because sometimes it's just once a day. Okay, so Carl, we have a call right now.
Yeah.
So
So
the
sore
meaning
is
of
the same
sore
as, what could we say?
is the same as, well, actually, it's the same as to be sore. So to be sore is to have a pain. So you would usually say, for example, you would use it as a description. Exactly, painful. Perfect, painful. So for example, I have a headache. I can say my head is sore or my head is painful. It's painful. Okay. Okay, and Francesco, yeah, so the prescription exactly is the thing that needs a stamp, and the doctors. So when the doctor writes his name, this is called a signature. Okay, a signature. So the doctor's signature. Okay, his signature. Whereas in the case of so when they do it, okay, they sign it. So that's the verb. To sign is to write your name. So to sign your name, and the signature is the noun. Okay, to sign your name. Okay, so if someone asks you for a document, can you sign this? Exactly. Then when you put your name, it's called a signature. Okay, perfect. So yeah, thank you for that, Francesco. Yeah, that's really good. Okay, and question number 2. Okay, do I need to take the medicine before or after eating? Okay, so sometimes this is important depending on the type. Okay, so the type of maybe medicine that you're taking, the type of problem. Sometimes you need to eat before you take the medicine, or you need to take it before you eat anything. Okay. So sometimes they might say to you, so the pharmacist could say to you, you need this on an empty stomach. An empty stomach. So that means there is nothing in your stomach that day. Or you need to take this a full stomach. So in that case, it just means there's something in your stomach. Exactly. So for example, if they say, don't take these painkillers on an empty stomach, take them on a full stomach. Okay, so just to mention another way to say that, before or after eating. Okay, and then number 3 here. So what are the side effects? So sometimes this can be important when you take medicine, because side effects are maybe the additional problems that you have from taking the medicine. So maybe it's something like it makes you feel tired. Maybe it makes you feel... Yes, exactly, Francesco. So yeah, that depends. So depends. So we say on the prescription. It depends on the prescription. Okay, it depends on the prescription. Exactly. Exactly. It depends on the prescription. Okay. So yeah, so side effects, again, are important because you need to know if you're going to have any problems. A common side effect that I find if I take some medicine is maybe I feel a little bit like my head is spinning. Okay. My head is spinning. So if my head is spinning, okay, if my head is spinning, how I would describe this in English is I am dizzy. Okay? So another way, I am dizzy. Okay? Or I feel dizzy. I feel dizzy. So that means like, I don't know, I don't feel very well. My head is spinning a little bit. Okay, giro di testa. Exactly. I am dizzy. Thank you. So yeah, that's a common side effect. Common side effect. And then number 4, can I drive after taking this medicine? Very important to know. Francesco, no need to apologize. Don't worry. That's what we're here to apologize for any mistakes, okay? And also, I always make mistakes when I'm typing anyway. It's it's very normal. And also, it's 9 o'clock on a Monday. Okay, so in this case, obviously, it's very straightforward. It just means, so is it okay to drive? Okay, is it okay to drive after taking this medicine? Sometimes you take medicine or you take something and maybe it makes you feel, so what we would say is sleepy, or another way to say this, it makes you feel drowsy, okay, drowsy, when you can't stay awake, okay? So if I say I feel drowsy, it means you have a problem with staying awake, or yes, you feel sleepy, okay, drowsy or sleepy. Okay. So remember, I always write quickly. Very good, quickly. So to write quickly. Exactly, there's the spelling, quickly. Don't apologize again. Don't worry. Okay, and then the last one here that we'll look at. So can I take this with other medicine? Okay, can I take this with other medicine? Very important, because if you're taking something, maybe you have to take medication for a long time, and you need to know if they can go together. Okay, if there's an okay mix with these. Okay, so this is just a clarification, just to check if it's okay, if there's no problems. Okay, so guys, we're almost finished. But what I would ask, so if you have any questions or any confusion about this, please let us know. So type to us any questions you have or anything you want to clarify before we finish. So we have a couple minutes just to look at that. Cathal, before Francesco, don't worry. What a mess. Don't worry at all. Cathal, do you have anything to add before we finish? Any other types of vocabulary that would be useful for the pharmacy or when you feel sick?
I mean, we've covered a lot today. I think that what we have is very, very good, and it's a good place to start off from. And once you're confident with this vocabulary, I think then we would go on to some more maybe complicated one. But for now, this is all very, very good, very useful vocabulary for sure.
Exactly. So again, the purpose of this is if you're ever, or also just in general, when you're speaking in English, to describe if you were sick, okay, if you were sick or if you had a problem as well. So as I said at the beginning, sometimes when you travel, you can get sick very easily. So this is a way to kind of to be able to explain your problem or if you need medicine in the pharmacy. Okay, guys, so if there are no more questions, I would just like to say thank you so much for joining us this morning. And
Thanks,
thank you
guys.
for all your questions and your participation. As I said, Cathal will be back with another webinar at 12 p.m. So Focus 6 to 7 if you want to join, or there will be others on in between. Okay, so guys, have a great day. Okay.
Bye-bye, guys.
Bye. Sorry, it's just taking a second.